Hi, good afternoon. This is Martha Davis Alexander. I'm the host of Courageously You with Martha, and I am so very excited today. I'm just going to skip all the stuff about me, and I'm going to get to my really special guest today. Nisha Manek is an alumnus of Mayo Clinic, people. Mayo Clinic's Division of Rheumatology and an internationally recognized leader in integrative medicine. She turned her scientific expertise into the singular question vexing humanity, the nature of consciousness. This is going to be a fabulous discussion, people. In her bestseller, Bridging Science and Spirit, The Genius of William A. Tiller's Physics and the Promise of Information Medicine, she presents evidence that human consciousness has the power to change our world. In her commitment to innovative approaches, I lost it. Hold on. Innovative approaches to, I lost it. What the heck happened?
Oh, Martha, you're doing great. Here, I'll finish it up for you. In her commitment to do innovative approaches in healthcare, okay, I synthesize both spirit and science together. They have to go together. And in medicine, we don't. We separate the two. So I'm saying
Western medicine, we separate the two. Eastern medicine doesn't separate it as much, right?
Not as much. Yeah. So I'm really referring to the Western traditions as we know them. Yes.
So, and she is it, people. And I have to say, I am so excited to hear you. I was just telling you just a little bit before, right? My experience with Western medicine in the last few months, my daughter has been in the ER at least a couple of times a month, and the first week of January twice. And I feel like a football being passed between doctors and back and forth, and medicines coming out without ever getting to the cause. And I feel like I'm never going to get to the end zone. And I think that's relevant to having consciousness as part of medicine. And so I cannot wait to hear you. I can't wait to talk. Cannot wait.
Well, yeah, you know, Martha, so you bring up an important point. I'm a rheumatologist. So I take care of people with immune diseases. All right. They have rheumatoid arthritis, they have lupus and other things. You know, fibromyalgia is a big one. Okay. So these people are struggling with really an inflammatory conditions for a lot of the years, productive years. They're, you know, wives, mothers, and then they're holding careers and they're going on with this hamster wheel of a medical system. All right. So I'm a rheumatologist. I'm watching this in my patients. And I regularly hear this. You know, I do telemedicine. And I don't, I take patients by referral if they want integrative care. And this is what I hear, Martha. And I think you're saying the same thing. You're echoing that my doctor has got their head in a computer. They're ticking off things. I have a 10-minute visit. I'm a number. I'm frustrated. I'm not being heard. I'm terrified. I'm searching the internet for answers to my problems. And actually, it has confused me even more. Should I change my diet? Should I take a supplement? Should I do this? Should I do that? Meanwhile, they're suffering. And I'll tell you, in rheumatology, if you take a cross section of my patients, let's take fibromyalgia, which is a big one. Okay, it's a big catch-all, big banner. Okay, we see a lot of this in young women. And if you do, you know, a survey, if you say, how many of you patients are taking integrative medicine? Integrative means non-mainstream. They're doing massage, they're doing yoga, they're taking fancy diets, all of these things. 100% of them. What does that tell you? 100%.
They're not finding the answer in the medical field.
Not only that, okay, they could be taking charge of it, but they're spending a lot of money out of pocket, and they're not satisfied with the
Yeah.
answers of more medications, more
Yeah.
drugs.
And that is, of all the places, right? Every time we go, there's another drug. There's just another, oh, here, let me give you this prescription.
Yeah.
I don't really want the prescription.
So I'll tell you this.
They said we'll give you antibiotics that you can take every day.
Wow.
I'm not giving my 19-year-old daughter antibiotics every day. That's ridiculous.
You're right. You're right. So here's the big gap in medicine, okay? We are leaning very firmly into chemistry all the time,
Yes.
as though that's the only thing. And yet, drugs do not touch the multidimensional being that your 18-year-old is.
No.
She has deep wishes. She has many things apart from, oh, I got to go to the ER. Now, if you have an infection, okay, you've qualified it. You have an outcome. You have, okay, 7-day course. You can see the light at the end of the tunnel. If you say you're being bounced around like a football, it's time to sit down with your primary care and really have an honest 15-20 minute with good questions. Top 3 questions. Ask. If you have good questions, the doctors will meet you there. Okay.
I love her doctor, and her answer is almost always, I would do the exact same. I mean, that's the protocol. That's what we do.
Oh, really? That's what she says?
So she's, I really think that integrative, right? Bringing the consciousness into, right? Into medicine, so that chemistry isn't the answer.
Right.
Chemistry
is let me,
sometimes
I'm interrupting. Yeah, I'm interrupting you. I apologize. You're right. So although we think of chemistry, I would say that there is a need for medicines. I'm not going to say, oh, let's dispense with it. But I would say that making patients aware of their role in their conscious evolution in medicine, when you join the two, you're going to reduce failure rate of those antibiotics.
Okay, explain that to me. Bring that down to me. Elevate the conscious level. Bring that down for me.
Nothing in medicine works 100% of the time. Not 100% of antibiotics. That's why we pick and choose, trial and error. The same in rheumatology. I pick one medicine, I pick another medicine. Hopefully their insurance will pay for it. Then I pick another medicine and we try it while the patient is going through these assessments in my clinic. But I have found that if you teach them basics of conscious meditation, if you teach them the very basics of breath work, paced breathing, if you teach them just these simple skills, guess what happens? Their medicines do work. But if you leave all of that out and you just say, oh, here's a script, see you in 6 weeks, see you in 3 months, you reduce the failure rate of even necessary drugs if you teach your patients how to do conscious meditation, contemplation. Now, why do I say that?
I'm fascinated. Please tell me. Why do you say that?
So one of the things that made me, leave academic medicine, Martha, I was at Stanford Immunology. Then I went to one of the ivory towers of medicine. But I saw these limitations. I was seeing that, hey, medicine isn't always the answer. And in my own consciousness, I knew there is so much more here that we're not answering in medicine. But we don't have a framework to talk about energy medicine. We don't have a ready framework about consciousness. Okay, so I'm leaving academics to look for answers where medicine doesn't really go very easily. I'm looking for healing in places that medicine rarely ever goes. So I chose energy medicine first. Okay, I thought, okay, I can get my brain around concept of energy. Energy is central to nature.
Yeah,
it's central to us right now. Yeah. We wake up, we switch on a light, we make a coffee, we turn the car key on, we're driving our car. energy is so central to life. But so is medicine, because underlying the medicine is what? Energy, chemical potentials. Okay. So here's the thing. How can we bump up energy in the patient that augments all of their chemistry, all of their mitochondria, which are energy factories, all of their heart and brain and lungs and skin? How do we augment energy? Well, guess what? This is where my perception totally changed. Consciousness, if you're really focused, conscious intention, you have a source of energy. It's a source of energy that does work.
Yeah.
Okay?
I am totally 100% in your court on this one. I believe you. And I practice a lot of what you preach, right? I raise my vibration, my energy level, and my dog's energy level frequently during my podcast.
I love that, by the way, okay? Because that's sort of a different sort of energy that is sort of permeating our discussion. Is all good. I love it.
Good.
But look, here's the thing. No matter how depleted you or anyone can feel, we have internal batteries that nature has installed. Breath work, but there's also energy systems, the human biofield. How do you plug into that? How can you, because it's sitting there. It is a higher potential energy. It's like let me put a fundamental law, and I'm using the word science law, okay?
Right, I get it.
I don't want to turn your listeners off, but essentially it's like this. You have a hot cup of coffee. The heat, Lou, is going from hot cup of coffee all the way to the cooler air, and it becomes the same temperature. Well, guess what? Inside your body has a high energy source, like a hot cup of coffee, and it's always trying to discharge that energy down to your tissues, healing them. You just don't know about it. And I write about this in Bridging Science and Spirit, okay? Your body has connectors, and once you connect with them, literally at the bedside, you don't need any fancy, well, you could do fancy Tai Chi, you can do fancy Qigong, and you can get those pumps working and that energy to cascade down high to low throughout your body. But even that is complicated. But you actually have a battery right now, a spark plug right now. All you need to do is connect with it, okay? Now, it's hard to describe all of this. It's really a very simple thing in my figure, in my book, in 6, with pillar 6. My book is constructed like a pillar. 1, 2, 3, 4, and 5, and 6, and 7. 7 pillars. So in pillar 6, I talk about what do all of this consciousness thing, the science of intention, source of energy do for medicine, right? That's called information medicine. So we're expanding our perspective from just energy medicine to your intent and how that engages the energy systems and gets that pump flowing from high to low, nourishing all of your body. Okay. And it's called the Eamon's relaxation circuit, if I can use that. Eamon.
You can.
So Leon Ernest Eamon discovered this. He was a British pilot and in the Royal Air Force. He was so injured, and I'll tell you, modern medicine in those days, in the late 1800s, 1900s, had given up on him. You cannot fly ever again. And you know what happened to Mr. Eamon was this. He said, there must be an answer. He's riddled with pain, on a hospital bed, being given a life sentence. Now, imagine me doing the same thing. You got this, and I don't have nothing more to offer you. I don't do that anymore. So Mr. Eamon is thinking to himself, wait a second. Master Jesus, the master healer, says, with the laying of your hands, you unlock great powers of healing. Your hands are very powerful. So he went on to say, wait a second. If Master Jesus was pointing to something, maybe he is saying something is inherent in our bodies that we lay our hands on it. And through trial and error, he discovered, wow, we have subtle energy systems. wow, we can just connect with just a simple posture of our body. Boom. He was in better health in 2 years after his subtle energy discoveries than even as a pilot flying those Royal Air Force planes.
Wow.
How is that possible? Now, listen to me,
I'm
Martha.
listening.
Eamon was injured. We said irreparably. And what I'm trying to tell your listeners and you, Martha, is that we are renewing ourselves all the time. The Martha that's in front of me now wasn't the same Martha a year ago.
Oh,
And
gosh, no.
you are renewing your tissues, your skin, eyes, thyroid, kidneys, everything is renewed all the time. Okay? 6-8 weeks, we have a new body down to the bone marrow. So, what if you were to do this, plug into the energy systems? What do you think that will do to the deep tissues and healing inside of you? That's where I'm coming from. That we need to tell our patients this. You can have a prescription. You got to do this other thing too. Yes, intention. And I teach my patients how to write an intention at the bedside. Okay, we go through it. You say, what's deep in your heart right now? Actually, they're rather surprised with the question because nobody asks them these kinds of questions except when they come to Dr. Manek. And I go, no, we're going to go into your consciousness. And if you're nervous, let's breathe first. Let's do a few breaths. We both sit, we breathe, and then they get some clarity. The chaos sort of settles out. Now you can have your consciousness bubble up and they get clues. They get clues. Okay.
So do you use, let me ask, because I just want to make sure that I understand and my readers understand. Do you use consciousness like the same as your unconscious mind or your subconscious, or it's called so many different things, right?
It is an exceptional question. Exceptional question. So here's the thing, and you're right. The conscious mind, that is the awake mind, is actually on sort of its bandwidth is really small. It processes information just a few bits per minute or whatever it is. Okay, information comes in bits. The subconscious mind is where the power lies, and you need to go there, and you should not be afraid of it. You should not be afraid of it. May I share a story with you that happened?
Yes.
Okay. So I had a patient with rheumatoid arthritis, okay? And she's doing just fine, okay? And then I get an urgent phone call. I need to see you urgently. I'm in a flare. That means she had inflammation. And I make an emergency because these patients, when they're suffering, it's really awful.
Mhm.
So I examine her, and sure enough, she had a very, very swollen joint. I adjust her medicines. I give her prednisone, which is my chemical mind. Okay, I'm a very linear scientist that way. It didn't work. She calls me back, and I said, okay, come on back in. Let's re-examine. I do an MRI of the joint, looking for infection, looking for something that might be wrong that I've, maybe missed. MRI, yes, there was swelling, but no infection, nothing else. I was quite worried now because when you have uncontrolled inflammation in a joint, you can get damage and contractures. They sort of freeze up in one position.
Yeah.
I sent her to a rehabilitation clinic where I was in this academic center. And lo and behold, she saw a very wonderful colleague of mine. Now, this colleague is looking at what Dr. Manek has done, all of the adjustment in medicine, the imaging with MRI. And she turns to the patient and said, well, what do you think is the message in your elbow? What do you think it's teaching you? Guess what happened? Without missing a beat, the patient said, I'm holding anger in my joint.
Wow.
Wow is right. It was nothing to do with, so flare of disease can come through the subconscious.
Absolutely.
There was something happening to her. And lo, my colleague who was enlightened, she's a very wonderful physician, said, you've done all the right things. So there must be something going on here. What do you think the message is? So, my colleague calls me, pages me in the evening after clinic and says, your patient, the one you sent me, she's going to be okay. She's holding anger in her joint. And I thought, oh my God. Oh my God. And
That doesn't go away with prednisone. That doesn't, you can't see
No, it
that on an
doesn't.
MRI.
But here's the thing. Here's the deeper lesson. The patient made the connection.
Yes.
She healed and transcended a really deep emotional hurt. Do you see? So
I do see.
she saw that, and as a physician, it was really amazing for me. And she was a changed woman. And so I do this more and more. I want to know the stories, and they are subconscious oftentimes. God bless her, because she was at a point that I think it was ripe to be going there, and she without a beat said, oh yeah, I think I can see what's going on now. In the safety of a medical clinic, she made the connection, shared it, and she became wiser. She transcended that lesson. She was not the same. That kind of impulse, now she's learned it, doesn't have the same consequences of repeated flares, repeated things. And I can share many stories like that, because when you
Give
really
us
dig
1
around,
minute, because we are going to go to a commercial break really quick, but we will be right back. Remember, people, I love to dance. This is fun music. Dance with me. Thanks for coming, Elena, and I'm so glad you're enjoying it. And make sure you come back because Dr. Manek is just a wealth of information, knowledge, and we are learning so much. So we'll be right back.
I have another story like that. I thought, oh my God, it was.
Oh, love that. It's always so fun to have just that momentary break. Welcome back, you guys. This is Martha Alexander, the host of Courageously You with Martha. You can reach me at marthadalexander@gmail.com or courageouslyoucoaching.com, or you can text me or call me at 805-422-6865. And I have with me a very special guest, if you're just joining us, Dr. Nisha Manek. She is consciousness. She's a doctor. She has been at all the Ivy League places, right? Stanford, Mayo, as an educator. And my dog finds that as impressive as I do. And she is talking about bringing consciousness, right, into medicine. So bridging science and spirit and the future of medicine, and how we each kind of have a responsibility to our bodies to up level our energy and help ourselves heal, right? Is that kind of what you're saying?
Absolutely, Martha. The thing about medicine is, and it came to me, is that patients often say, tell me what to do, doctor, right? They want to get better. Tell me what to do. And the shift that has happened in me since doing the work in energy medicine and consciousness research with Professor Bill Tiller, he was my physics mentor, was this. He has shown under lab conditions that humans are incredibly powerful. We change things. We make things happen. The problem is all of us have doubts and we're wavering there and then over here and then over here. No, Tiller always said one thought, intent, focused, decision. And that comes also from the subconscious. once that's given meaning and it animates you, first of all, that itself unlocks a lot of energy. The patient with a joint related to anger, just imagine what happened. She releases that, makes the connection, but there's great relief and energy release. She
Yeah.
felt uplifted. She felt joyfully. I didn't have to do any more steroids in her. Just look at that, right?
That's
So
amazing.
she was healed from her own self. And so Tiller has shown that when you have a conscious intent, when you have had some practice in meditation, then you have a chance now to really make things happen in your life. Your intention has great power. End of story. Okay,
I
we
love
are
that.
literally like masters in the making. We are like all of us. We have to stop the kindergarten behavior and now graduate to really high level of living, not just existing from day to day. Oh, I have to ask my doctor for this. It's okay, but now really power up your personal practices. Even start with, in the morning, my mantra is pray, eat, and exercise. Pray, eat, exercise, in that order. So take time. Take time to close your eyes, be in silence, drift down to your heart, center of your chest, dwell there, rest there. Just that simple practice already, you're on your way. Just
I
that.
love that. I do
Mhm.
that every day. I have to admit, it's coffee and then a little later that. But can I share something with you?
Of course.
My word for my words, my theme for 2023 is intentional action. And
Yes.
intentional with that, right? With going down,
Mhm.
with having that intentional action.
Yes. So, a lot of people, when I tell them, what has great meaning, or let's create an intention at the bedside. I always do that, and most people don't know how to write one. Okay, so one advice for your listeners: get a notebook. Get a notebook. Start writing it down. Even a sentence, I'm going to be more intentional today. That's an intention. I'm going to do paced breathing. That's an intention. I am going to do better coffee. That's an intention. By the way, Martha, I love coffee, but I pray first, coffee, and then a little exercise.
Well,
Yeah.
the first thing I do when I get up is the dogs have to have their kisses and their loves because I can't get out of bed until that
Yes.
happens. They just
Yes.
don't allow it.
Actually,
And in
that's
that,
prayerful because
yes.
it's of service. So that's actually action coming from the heart. That's
Oh, I
prayerful.
love my dogs. And then I get up and say, It's going to be a fabulous day. I look forward to today.
Yeah, that's an
Right?
intention, by the way. That's intention setting. That, the past has no power over us. The past is gone, dead. It's your decision of the future that pulls you into the future.
Yes.
Think about that. Your
That is
future is
so
pulling you
powerful.
in. Yeah, it's pulling you in.
So, what do you want for your future? Visualize it, see it, and let it pull you in.
Let it pull you in.
Yeah.
Absolutely. Write the intentions though, because you see, we're now dealing with intangibles, right? It's in your imagination, it's in your heart, it's in your subconscious. And as a subconscious, now that you're inviting this with a notebook, you're really writing things down. Don't judge. By the way, don't judge. Just do it. Then your subconscious is now going, okay, let's give a little kernel of information to the conscious mind. And then you have to be alert enough to give it meaning. All right. And look, my patients, when I do this exercise, there's been a whole host of wonderful things that come up and they go, oh my God, that was my childhood thing. I never knew it's still alive. And then a new set of energy is released. Just
I love
imagine.
that.
Okay, they're not sort of locked in, oh, Dr. Manek, my pain today is this, and my blood test results are fine. Okay, I do that. That's my job. But I want to raise their expanded thinking and to say, you are ultimately in charge. Go there and go with permission. You are, okay, let me put it this way. The person you're looking for is you.
Yes.
Can we say anything else beyond that?
Not
That's the
really.
truth.
I mean, that really is, right? That really is kind of sums it all up, doesn't it?
It does, Martha. The person you're looking for is you. And actually, I think it's Swami Muktananda who has said that look in the mirror. The person who's looking back at you is who you're searching for. So I think the more and more you can just say, wow, okay, my kidneys have an infection. I have rheumatoid arthritis. Okay, what's the lesson here? You do go there, okay? And you will get answers that will blow your mind, okay? I've had family situations resolve, I've had ex resolve, I have, people go, I've had fibro forever, what's going on? And the 10th doctor here, and I say, look, it's not all of the structures are fine on x-ray. What is the lesson here? Now, having listened and really, and sometimes if they're not sure, give them 10 minutes, switch off the lights in the exam room, give them time, give them the space, and assure them, I'll be here for you. I'm just in the next room. I want you to meditate on this. And again, the answers that bubble up are really, they're healing themselves. They're making the connections.
The truth is, your unconscious mind is all powerful and all knowing when it comes to you.
Yes.
It knows everything.
Yes. It is a repository
The
of
span of
information.
time, right?
Mhm.
It knows
Yes.
everything.
Yes, the bandwidth is huge, and not just this lifetime, of previous,
Yes.
of all of your family tree, all
Mhm.
of it's there. And then you know what? I think, Martha, once you know the context, the content is, oh, I've got all of this. The context is filled in. Now you have a chance, you have an okayness, you have information that you go, oh, I understand the context of what's happening to me in my physical now. That's a very powerful way to live life.
A very powerful way to live life. Yes,
Mhm.
absolutely. And I believe that actually it was how we lived life at
Mhm.
one time.
Yes. Yes. I think, certainly I come from Kenya, and my upbringing was very, very spiritual. Okay. I was raised in a Hindu family. I love Buddhist traditions. I've read all of those. I love Christianity. I've been to Padre Pio in Italy, pilgrimages to all kinds of monasteries,
Mhm.
Catholic. Okay. There is great beauty. Oh my goodness. So, and one of the things I used to prescribe, and I still do actually in my course, I've just had a new course released this week. One of the things I have done regularly is recommend Psalm 91. Psalm 91 is God's shield for you, with you. And one of the verses says, he shall give his angels charge over thee to keep thee in all thy ways. They will lift you up in their arms, lest thou dash thy foot against a stone. You have guides. You have to invoke them.
Absolutely.
Contemplative practice. Psalm 91. No plague can come near thy dwelling. How beautiful is that?
It is
What
absolutely.
a promise God has for you. And it's not some outer thing, it's us, it's our spirit.
uh,
I love your dogs because they
and
bark at exactly the right moment.
yeah, and we are one with them as well.
Oh.
They are just perfect. Yes. So, I love, we really are, and we've talked before about being on the same page and
Mhm.
believing very similar things.
Yes.
And
Yes.
I love your message. What I would like you to do, we're gonna close in just a little bit, but I want you to tell people how they can contact you, how they can get your book, what your course is about, right? Give them the opportunity, because I think the more empowered uh, everybody is, the
Mhm.
more healthy we are, the healthier our planet is, the higher the energy level on our planet, and the better off we all are. So
Yes, a better planet starts with you. How many people does it take to save the planet? One, and it's you. You're the chosen one.
excellent. I take it.
So your listeners can look me up on nishamanekmd.com. My book, Bridging Science and Spirit,
Hold on,
is
just
available.
stop 1 second.
Mhm.
I'm going to spell that for them because some won't get that strip underneath us.
Oh,
So
I
it's
see.
NISHAMANEKMD.com.
Mm-hmm.
Okay.
And thank you, Martha, for that. Bridging Science and Spirit is available on Amazon, and it is audiobook, Kindle, and print versions. Okay, it's done very well because I self-published, and I'm a clinician and get on with it. But I realized when I'm talking about consciousness and energy and intention, people need a direction. So I've done this course, Rheumatoid Relief, 5 Essential Keys to Living Well with Rheumatoid Arthritis. It went through a pilot phase and I was absolutely stunned. A couple of people just went near remission and I thought, how is this possible? But of course it is. It's like what we have discussed.
Yeah.
Once they give themselves permission to explore the energetic systems, to explore their deep wishes and intentions and write it out, magic starts to happen. It's, yes, your doctor is there, but do these other things that bring you great joy. Wow. That's
Wow.
information medicine. Okay, that's what I say. Wow. So the course is ongoing. It's close to registration now. It's just 5 weeks. It's short. And I will make it available to a greater number of people probably later in the year so they can check back on the website.
Beautiful. Beautiful. And so I know you focus on rheumatoid arthritis and then the autoimmune diseases, right? Are there other things that you're going to bring this to, or are you teaching other doctors how to bring consciousness to the healing of their patients?
You know what, Martha? Great question. I'm shouting from the rooftops. Okay, I want to bring my colleagues right on board. The system right now in medicine is going to go through tremendous shifts. It has to, okay, to give people time for critical thinking. I walked away from academia. I carved out my time so I could do the critical thinking and study physics and know, whoa, this is true. It's scientific fact that humans are incredibly powerful. It's not just mouthing it. It is literally the numbers prove it, okay?
Yeah,
So that's bridging science and spirit. So I'm shouting on the rooftops to tell my colleagues. I presented this to groups of rheumatologists and invited them, look at the course. I can help you. We can really make a change in this big ship that's going astray. We have to course correct and we have to do it quickly. All right. I think it's going to come. It may take some time. All I know is my message is timeless. You can do it now, 3 months, it's timeless. 3 months or 3 weeks. Oh, wait, I meant to say 3 years, 300 years, timeless. My message will stand the test of time. I know it. Okay.
I know it too. So I totally believe that.
I'm persevering. I have the tenacity, and I'm going to be just, Nisha, do your thing, help the people, get them really uplifted. Because look, Martha, here's the thing. Every person that wakes up to their power helps not only themselves, but their loved ones, their communities. They radiate a different quality. That's waking up in consciousness, okay? So we come away from this self-absorption of, oh, my health, my diagnoses, my labels, and go to, oh, wait a second, I'm in charge. I can heal myself. You're a much more joyful, multidimensional being that God is. You're created in his image.
Yeah. You're not in 3D. We live in a 3D world, but you're not actually a 3D
You're not a
person.
3D person
You're
at
not.
all. Well said.
You're not in 3D. Let's get beyond that. We can
I
move
said
past
graduate from kindergarten. Let's go higher, higher.
Let's move. Ugh, Nisha, it has been so awesome to have you as a guest. I have so enjoyed it. We'll have to have you back. I'm sad we're out of time. Any last words to the audience?
Well, if there's one thing I want to say is intention matters. You matter. Just start. Take a notebook and write down what's deep in your heart. Yes, revise it. Don't worry. Don't judge, but write it down. Start the practice. And before you know it, in a year, you'll be looking back and going, whoa, it all came true. It really does. So intention matters. That's my bottom
Intention
line.
is everything.
Yeah.
Thank you so much for being a guest, you guys. If you want to get in contact, you can. NishaManekMD.com. And if you want to get a hold of me, Martha Davis Alexander, you can reach me at marthadalexander@gmail.com. That's MARTHADAL. I'm sorry, MARTHADALEXANDER@gmail.com. I almost spelled my whole name for you, people. At courageouslyou.com. It has been a joy. Until next week, you guys, I will be here again at 3 p.m. Pacific. Every Thursday, we are live, and I cannot wait to see you again next week. And remember, courage is not the absence of fear. Courage is taking action with the fear. So make sure that even if you're hesitant to write those intentions, write them anyway. Don't judge. Nobody else is going to look at it. Just do it. Take a step. Take a step on the wild side and let your unconscious mind dazzle you with its brilliance. Until next time, guys, have a great day. Bye-bye.